Miss Rio, it's nice to put a name with a face. You're Manhattan? You're from Manhattan?
No.
Where are you from? You got New York accent.
Oh my God.
Oh, she's here. She's here.
Where'd you from?
Yeah, I was born in the Bronx.
Ooh, Miss Rio from the block.
Good morning and welcome to
You still have that?
Housing Options for Seniors, sponsored by Humana. We are here live at Point East. Thank you for joining us. And Lily Ramos is going to explain to us what some of the housing options are for seniors. I know we are often faced with difficult decisions and we don't know what to choose. And Lily is here today to help us sort these things out. Thank you so much, Lily.
Thank you for the invitation. And thank you everyone for joining us.
Can you make a bigger screen or not?
I don't know, but then why is that coming in this though? What's that?
Did, Ms. Donna tell you that I charge a question, a quarter per question, because I don't? Okay, moving on, folks, living with a relative. Now, this is a wonderful option, believe it or not. Having multi-generational members of a family under one roof. You know, it benefits not only the old individual, but the young as well. Okay, or maybe it's just impossible to live with a family member. You know, not every family is the same. Okay, now keep in mind, you gotta have those questions answered. Is there enough room for everybody to live under one roof? Okay, would I be able to receive the care at home if I should need it? Maybe I need medical equipment, a hospital bed, wheelchair, walk. Okay. Is the arrangement acceptable for everybody? Is everybody in the family on the same page with that? Okay, that's important as well. Okay, as well as what's needed to make the home safe for that individual that's in need. Okay, so those are just some of the questions that have to be made or have to be addressed, if you will. Any questions so far? I hope Donna didn't tell you that I charge for questions, because I don't. Okay, so moving on, folks. Shared or congregate housing. Now, as options that you have, let me explain the differences between these two, because again, they are options that an individual has. Shared housing. Basically, what shared housing is, just to give you a simple explanation, is more like a roommate type arrangement. Okay, basically, you have your own room and your bathroom, but you share the common areas. Okay, and it's more towards the lines of more of a social support system, if you will. Now, congregate housing, congregate housing is a little different in which these are actually small apartment units. Okay, you have your own individual apartment. And basically what it is that you share the common areas, like the kitchen and the living room and things like that. So that's an option. Okay, any questions on that? Well, I hear crickets.
Well, you keep going, but
Wonderful. Retirement communities. Again, these are referred to as mixed age communities because again, there's 55 and over communities that are available. So not everybody is of advanced age at these facilities. Now, senior villages. Let me share something about these senior villages facilities. Basically, with these types of programs, you pay an annual amount, an annual fee. And with that annual fee, you have little perks, if you will. You know, you get membership, for example, to all the social events. You get some healthcare services that are available through there as well. And I'm sure that you're familiar with this because here in this area, you've got some wonderful senior villages, if you will. You got the V, the Sterling, okay? In Broward, you have Century Village. Those are all referred to as villages, guys.
But V is a closed facility only for residents.
No, they have a separate facility. They have a separate facility.
No programs from outside community.
It's private.
And actually it's private. And
private.
actually I complained to the mayor.
Oh,
That
well,
the
I don't know what to tell you on that.
Aventura, City of Aventura is doing nothing for.
Well, that's another presentation for another day.
That's right.
But I
That's right. And that's the richest city
Right.
and we have so much money to pay with our taxes
Mhm.
and they doing nothing.
Right. Well, again, I mean, it all depends because these facilities, again, money,
You know, but.
Right, I understand what you're concerned about.
And Aventura is a senior.
well, that, you know, I don't want to get lost in the weeds here, if you will. Let's just go ahead and continue on with the presentation and we'll discuss that later.
Is assisted living.
Right.
Yeah,
That is correct.
Yeah, but that's not, well, how is?
But that's another option that's available
Yeah,
with
but
these
how can
programs.
that be in the same category as essential?
Because, I'm just giving you a scenario.
And you said they're both formed, so that's
Mhm.
why.
Right, well, that's what I'm saying. There are the different options that they have.
But you know how much is G per month?
Oh, yeah, I know.
You know,
About $8,000-9,000. There you go.
12 now.
Oh, 12, there you go, okay, woo, all right, well, moving on. And again, guys, let me tell you one thing, you know, nothing is perfection here,
Change the
okay?
mayor.
All of these options are based on cost factors as well. When you make these decisions, cost is number one on the list. So keep that in mind. Now, naturally occurring retirement communities, also known as NARCs. So I don't know where that's
That
at.
would be something like here in north.
Well,
Yeah.
we can find locations here to
But
provide
it's
that.
like this, Point East is a naturally occurring.
Exactly, there you go. Good example, thank you. What would I do without you, Ms. Donna?
It's a good place beautiful place is on 55th Street Jewish Home.
Okay,
That's another
That's
beautiful
it.
place.
Right, well, we're getting ahead of ourselves, but anyway, this facility here, Point East, would be considered something that,
Go inside.
excuse me, something like Point East would be considered something like a naturally occurring retirement facility, if you will, as Donna mentioned. Thank you, Donna, for that input. Now, basically, these facilities, they are supported by government as well as charitable organizations. And this is another option that an older individual has available for them as well. Okay? Yeah, we're gonna get to that.
I didn't expect us to take care of them.
Yeah,
I'm not assisted living.
right, well, I know, we're gonna explain that a little later on. Okay, continuing care retirement communities, which are called the CCRCs, actually, okay? And these are usually made up of progressive levels, and folks, let me point out to you that there's like 3, okay? Independent living, assisted living, and nursing care, okay? Basically with this option, and it seems to be some people that prefer this kind of option, is basically you're there, you stay there, and you receive all of these services there as you continue to age. All right, any questions on that? Moving on, all right. Assisted living facilities. Now, folks, this is also known as ALFs, adult living facilities, or long-term facilities. Now, basically with this type of facilities, folks, I want to point out to you that typically there's supervision there, there's meals, there's housekeeping services, and there is help with ADLs. So this is basically where the person resides. And also, many of these assisted living facilities, they also provide something that we remember from back in the day. House calls from doctors. Remember those days when doctors used to actually go to your home and see the patient? So that's available at these types of facilities as well. Any questions on that? Now, keep in mind that a patient that goes to one of these facilities, they can't require a 24-hour care, all right? Any questions on that? Nursing homes. Now, this is another option that many have available. You mentioned the wonderful facility, which is the one on the Jewish facility, the Jewish home, which is a wonderful facility. Beautiful facility. Okay, now this is basically a licensed facility for people who can no longer be cared for at home. Maybe they were initially with family members, okay, maybe even friends.
No, that not only, they have 3 stages. They have a residents who can walk and talk and they come for 5 days. They have a residents who are in the weekend and they have a like hospital. This is so well maintained. And I take students, the nursing students to just practice.
Right.
Oh.
It's just beautiful place.
It is a gorgeous
And that
facility.
would be an example of other, senior community, how to build up, the residence for aging people.
Right.
Yeah.
So again, and thank you so very much for saying that, because the Jewish home is a wonderful facility. Yeah, they're partners with Humana as well. And keep in mind that everything that I'm explaining to you guys and all the options that are available, all of these are Medicare approved facilities, folks. Okay, so like I said, which one would you prefer? The one that meets all your options.
So,
Okay,
Lily, when you say they're Medicare approved options, Medicare pays for the medical care component that somebody receives when they're in one of these options, but the actual cost of staying in the place is at a different expense.
that is correct,
And that has to be covered by the residents.
by the individual.
So how does that break down? How does someone know which portion is covered and what the cost of the physical apartment, or the physical, how do they know that?
Well, first of all, it depends the level of care that the individual needs.
Okay,
So it's not a set amount,
okay.
because every case is different.
So is
Everybody's needs
there
are
are
different.
formulas?
It could be very expensive. It could be there's no gauge, if you will. Okay?
Okay, now I understand that Medicare will pay for the medical care, but Medicaid pays for the non-medical care for people who fall into the income category. Is that correct?
I think Ms. Donna saw my presentation before, so yeah. But to answer your question, absolutely.
I just want to make sure I'm
Yeah, no, you're right,
understanding
you're right.
that.
You're absolutely right, and we're gonna cover that as well. We're gonna touch on that. Okay, any other questions, folks, before we move on?
Actually, it's better to have a Medicaid than Medicare. Because Medicaid is paying for everything. And that's the
Well,
biggest question that we seniors have, because we pay for everything and it's better to have nothing. And then Medicaid covers
well,
everything.
there is, I know that we'd like to discuss that, but I do want to let Lily
Yeah,
finish
we'll
her.
continue on. We got a lot of questions here.
But
but-
there's more.
Moving
to
on,
it.
we got some time constraints, guys, sorry about that. Now,
No, that's okay, but we do
Next
want
year
to.
election, we're gonna get back to that.
there you go,
Right.
all righty, good for you. Well, choosing a facility, now, folks, keep in mind, it's all about asking the right questions. It's all about getting those answers to those important questions. Number one, when choosing a facility, I always suggest, and we do as well, ask questions, go visit the facility, go in the morning, or go in midday, go in the afternoon, go towards the evening. Check out the atmosphere, check out the interaction between the staff, the doctors, the patients. Okay, another thing, those questions, here we go again with all those questions. What living situations are offered here? Okay, another one, what services are provided? How much is it gonna cost? Because that is the main factor here. You are complaining about, certain facilities being very expensive, and they are, because a lot of them are private, so keep that in mind.
I'm sorry, I
Absolutely,
didn't hear
That's the problem we have.
that people move into this community with that assumption.
They put in their own parents who are not well, who need more care. And we try to help them, but we're not a facility.
That's a very good
And
point.
Absolutely.
these children just walk away.
absolutely,
Some are wonderful, they step up, but some don't.
No,
absolutely.
that's a very good point.
It's a
And
big problem.
And I think what you're seeing is that there are people who are kind of stuck because maybe they don't have the means to do what needs to be done, like move somebody into a place like
But
an
they don't-
ALF or the,
But they do, they don't want to spend the money, because if they didn't have any money, they could get aid and they could go anywhere for nothing.
well,
You see,
maybe
they
not
don't want to
anywhere
spend it,
because
they
they,
want to inherit it.
that's an unfortunate situation too.
Yeah.
And this is what we deal with. We do-
Absolutely, absolutely, and that's a wonderful observation as well, because I see it almost every day.
So
In my
you're
career,
seeing this
even in
too.
Humana, I see it every
Being
day.
on the board.
So this is the reason why we're out here, why we're expressing ourselves with these types of presentations, to help you guys plan ahead of time, before it's too late.
Yeah, like
You know?
mom and dad, move in with us, we'll live an extension to the house.
Yeah.
They give them moving money. And then, okay, get out.
So that's why I said earlier on in the presentation about staying put, living with family, that might not be right for everybody's family. So moving on, guys, moving on, how much will it cost? Look at this, how will my current and future health and safety needs be met? How will my decisions, how much independence will I have? Would I be able to go to synagogue? Would I be able to go to the movies with Nancy?
That's a very good question. Sometimes people want to be able to go out with their friends,
wanna
to
continue
maintain
their
those,
social.
those social
Absolutely.
relationships.
Absolutely. What are my legal rights if I don't agree with something at the facility? Again, another very important question to ask. Okay, standard. We talked about this a little while ago. We basically touched on it. But I want you guys to be aware that when I mentioned about facilities being Medicare approved, they have certain standards that have to be met. One of those standards is basically accreditation. And accreditation, basically what it is just a set of operational standards that have to be met. But then we have what is called the licensing. Now, this is more towards the governmental operation of these regulations, okay? So these two factors must be in place, again, in order for them to be able to provide for Medicare recipients as well as what? Medicaid as well.
So people in Miami-Dade County want to be looking for ACA approval, and they want to be looking for ADRC,
Absolutely.
right?
Absolutely.
And the Alliance for Aging oversees these things in Miami-Dade County and Broward County. It's the Aging and Disabilities Resource Center that handles that.
What would we do without Donna and her agency? Thank you so much, Donna, for that. I appreciate that.
Well, I'm so grateful to JCS and for Humana.
Thank you so much. And again, Ms. Donna's organization is a wonderful organization. We provide a lot of resources, and there's several partners that we're going to share with you as well. I just want to point one thing out. Okay, and I know that cost is an issue, we already discussed that on several, opportunities here. But I want to point out and be very clear with this, health insurance companies like Humana, for example, they've got some other wonderful, providers of healthcare out there also. They don't cover housing, guys,
No, they
they have
don't.
nothing to do with that.
Right.
All right.
Nothing to do with that.
Absolutely, okay, so what this means is that financially, it's your responsibility. Okay, first of all, I always tell my clients, you guys need to seek some sort of legal counsel, maybe, a financial planner, okay? Speak to someone that would be able to help you with that decision, okay? Your accountant or an attorney, if you will.
And that's a big decision, because
Absolutely.
many people are sitting on a house that has a value, and can that value be converted to liquid cash or capital that can help support a new lifestyle?
Absolutely, and that's a good point,
Right.
yeah. That's another, and again, there's been so many issues with that as well, that's why it's important to seek legal counsel.
The place estate planning.
Yes, and
Exactly.
it has to be somebody that is a fiduciary,
Right.
because that makes them responsible to the client and not to themselves.
Absolutely, and thank you for that, that's absolutely true. And again, we boil down to the same issue again, cost, how much is it gonna cost me? All right, another one, how am I gonna pay for these housing services? Now and maybe 5 years from now, 10 years from now, 20 years from now. How about long-term care insurance? Look at this, folks.
Oh, my goodness.
Let me just point something out. You folks may just have a policy active and don't even know it. Many of us work for banks and hospitals and all this, maybe we were teachers.
Yeah,
Through our employer plans,
I am the case.
there you
And
go.
I didn't know, and I discovered that like 3 weeks ago, they calling me because, Jackson, that's in Dade County.
yes.
And they have a,
They have a long-term care policy for you. There you go.
Wow. There I go.
Getting the letter.
And that's exactly the reason why I touch on this, because you don't know what you got until you need it, all right? I'm gonna take you back a couple of years, if I may, I'm gonna take you back a couple of years. You folks remember Superman, right? Superman, Christopher Reeve, handsome devil, wouldn't you say? Okay, you know that he fell off the horse, became a quadriplegic, right? We remember that, it was awful, okay? He was basically paralyzed from his head all the way down. This guy was a multi-millionaire.
It's true.
You know that he died broke, guys? And to think that this young man could have purchased a policy, long-term care policy, $30, $40 a month. That would have helped offset his required 24-hour care. There's people that have long-term care policies that are life policy. They're covered for the rest of their life. All right? Maybe your policy hasn't kept up with inflation. That's another thing. So look through your drawers, look through your filing cabinets, and see if maybe through an employer, past employer, you might just still have a long-term care plan, because this will help offset those horrible high costs for care. Okay, any questions on that? A deposit. A lot of these facilities require a deposit when you consider being placed there. Okay, now
That's true.
if you're not happy there, maybe a week or so, can you get your money back?
And one of the things that you just brought up is an excellent point in relation to that, because let's say somebody doesn't know if they really want to be in that place. They go visit, it looks like the right place, and they sign a contract, and they say, I'm gonna stay for 2 months. People do that. And at the end of 2 months, what happens? They sold their house. Where are they going now?
Exactly. That's a valid point. And again, how are you gonna access the financial security of the facility? Are they gonna be open in 2 or 3 years, you know? You need to be on top of that, and those questions, again, folks, need to be asked. Any questions on that?
No, that's really very good.
I'm doing good. Well, that's great. Now, making your own decisions, folks, and again, we boil down to this, education is power, okay? Make sure that you have all those directives in place. Make sure that you have someone assigned, if that's the case, to be your legal representative. Seek the legal counsel. Go to these facilities, visit them, as I said, morning, midnight, in the afternoon. Check out the association between the doctors and the camaraderie there, if you will. Okay, check out the space, evaluate the services that are offered. Again, remember the list that we went over, all of these options. They're all good, they're all great options, but which one is tailored for you? Which one will meet those needs that you have? okay? Consult with others. Word of mouth, that's a wonderful option as well. Speak to a professional. Now, let's review because there is a test at the end. I'm just kidding.
Yeah,
I'm just kidding.
I tell people that all the time.
These are the references. Okay, now, these are some of the partners that we have in the community that assist us, as well as with the JCC. They do a fantastic job, as well as the Jewish Community Services with Ms. Donna here. But these are just some of them that you will be able to access and get information, because as I say, information is power. If cost is an issue, get educated, find out what's available, what level of care is it that you want, maybe an ALF is something more down your alley, okay? In addition to that, elder care. And something that's missing from this list, and I want to take the opportunity just to add it, if I may, okay, is the Alliance for Aging.
Very important to
This is
know
an
about.
important agency, right, Donna?
Very important to know about them.
Absolutely, and not only for you, okay, as an older adult, but maybe your family members, your sons, your daughters, your grandkids, you know, that are adults already, able to make decisions. Why? Because this is a wonderful organization. And a lot of people may not know, a lot of you may have to spend on everything you guys got. Okay, maybe as Donna mentioned, you have to sell your property, sell your home in order for that care. Through the Alliance on Aging, and I will provide anyone with a phone number, again, it's called. It's a very important number to have in your phone, 305 670 6500.
I have
I'll
that
give
in
it
my
to you.
phone too.
I'm gonna repeat it again, 305 670 6500, and again, the Alliance for Aging. All you need to do is give them a call. If you have to leave a message, please leave it, because they do call back. They do call back.
They do, and you know, when you contact them, you may not realize all of the services that you are eligible for. And they'll do a screening and an assessment, and like the issue that you're having with people dumping family members in an apartment and leaving them without care. If these people have this number, they can call this number and say, you know, my parent, my mom, my dad, my aunt, whatever, is living in this apartment, and I think she needs help taking medication, or I think she needs help with her ADLs, you know.
There you go,
Well,
ADLs.
we use them also.
Absolutely.
We call family and children and they were terrible.
Well, yeah, children and families, so that they're not going to do anything, but the Alliance for Aging, they're the people that you want to contact. And throughout the state of Florida, there are, what are there, 8 of them? 8 AAAs in the state of Florida that cover the different sections of the state. So it's like the Alliance for Aging, but they are responsible for the administration of adult care throughout the state.
That is the best organization, AARP.
AARP is a wonderful
And they-
organization.
Magazine, I belong to them for years. And
Yes.
all resources, the best resources are through them. And after all, the monthly magazine, I think
Yes.
for years.
Yes.
This is the resource, the current information and whatever you need to do.
Yes,
So
that's
I
very
think that
true.
would be very good if somebody, and it costs penny.
Right.
You know,
That's very true, and that's a great point. And the reason I'm sharing with you this information and that Lily is talking about this is the Alliance for Aging. If somebody is home and they can't take a shower, they can't take a bath, they can't prepare food. It's not only through the long-term care insurance, but Medicaid has something called managed long-term care insurance that you don't even know you're paying for, that it's actually available to people in the state. Another thing that we don't even realize that comes out of other bills and other taxes is something called community care for the elderly. So for a nominal fee, until somebody is eligible to get into the managed long-term care, they may be paying anywhere between $10 and $25 or $30 a month to receive community care for the elderly. That's a bargain.
Absolutely.
And that is the care of the person, not the medical care, because Humana will take care of the medical care. But this is
Yeah.
the
Yeah,
physical
that's where our
need.
problem is.
And that is what you're talking about. That was the question you raised.
We had a man who was supposedly taking care of his mother, but we walked in that apartment, the graduate was disgusting, and to look at her, and we called them, and if you ever spoke to him, he's very polite, but we've had a lot of problems with him, right? You know what, they came back and said, if you ever bother those people again, we will fine you.
Oh
like
my
How do
goodness.
you like that? And we had another song. Then it was a couple of years later, then we figured, well, this guy with the bed bugs, right? He had an infestation. You couldn't reach his children anymore. They didn't want to know from nothing. How many times could they go? We had them keep spraying that apartment. And do you know, we called them for that. I called them for that. I'm the one who handled it.
And then,
No, we'll check it, and then when I called them, I see he's still living like that, they did nothing. We can't tell you, we've taken care of it, what they take care of, he's still living with bedbugs.
right, so when you contact, when a family comes in and they have a situation like that, the first thing I probably would do is recommend that they get in touch with the Alliance for Aging and say, you know, I know that you love your mom, that you love your dad, and you are probably so overwhelmed with all of the responsibilities that you have in caregiving, because caregivers feel overwhelmed. They feel
Caregivers, just give one man to the phone.
that may be so, but they feel overwhelmed. And by saying to them, you know, we're not creating an enemy, we're bringing them into our you know, saying, we understand, we're not judging you. And that's really critical, because nobody wants to be judged. We're all doing the best we can with the resources that we have. And saying, you know, maybe you didn't know this exists. This could really help your mom. This could really help your dad. There are things that do happen. And I don't know if you've seen this show. It was on Netflix. It was called I Care a Lot. And it was a very disturbing story about how a professional case manager acquired clients, and how they became quite wealthy by acquiring clients. So if you haven't,
We had someone, she recently moved out, she find these people who had no families, they wound up giving her everything.
well,
And
they
the
didn't,
children
they,
don't step
yeah,
up.
they don't exactly leave her everything, because some of these are not, there are good case managers and there are not good case managers.
Jewelry, the apartment, absolutely.
Did you write the movie? Because that's what happens.
Obviously, but Donna, thank you for that. And one other thing that I just want to add to what Donna was mentioning also, through the Alliance on Aging, they do cover the long-term care aspects.
Yes.
Okay, there is hope. Okay, there's light at the end of the tunnel. It's called the Medicaid waiver. Okay, there's also respite care for the caregivers.
Yes, and that's so important,
Oh my
the
goodness,
the
we
respite
need to support
care.
those caregivers. And also keep in mind that through the Alliance on Aging, through the Medicaid program as well, they can even be compensated. Now, they're not gonna be given $60,000 a year, okay, but they will provide a little stipend every now and then, you know, monthly, for that caregiver as well, you know, because they take primary care of the clients. Okay, usually that happens in home situations.
Right, and when we think about it, you know, many times we have people that are now in their 60s and they're pretty healthy and they're getting along. Some people are still working. Some people in their 70s are still working.
Yes.
Some people in their 80s are still working.
Our politicians.
Yes, they're a great example of longevity of career.
But they
I don't know what else they're a great example of, but longevity of career, I would say. But when we think about it, not everybody has the wealth to maintain the care. And while you may have the strength to go out to work and you may be tired by the time you get home, and if you're the primary caregiver and the breadwinner, you might be feeling a little overwhelmed there. You might be a little tired.
Absolutely. I remember when my aunt said she feels bad for the sick person, but she feels
that's something we really need to value. And I'm so glad you guys came out here for this presentation. I hope everybody who is hearing this, whether you're following us on Zoom or whether you're following us on YouTube, thank you for listening. And if you have questions, please reach out to us at JCS, or please reach out to our friends at Humana or your insurance provider to make sure that you get your questions.
Yeah, she's on Zoom.
Yep, we wanted to make, whatever we're doing, we're trying to keep that hybrid situation going. Because we still have people who are not coming out to places, and we are here with you in person, but we still have people that are not able to get out and do the, or whatever. Yes.
Is well-established community for years.
Yes.
We were used to have it because
Oh,
that's the retirement community. And that's such a, because she was dealing with all those problems that we have now. We don't have a social worker anymore. And actually, nobody is responsible for just transferring the problem as it arrives and solving the problem.
that's a very interesting situation.
And not a health facility.
And we always had that, because the community is aging, that we well spent money to get between corporations, small
Maybe
corporations.
we had the wrong one.
That we wrong. We need to get the right one.
Well, I do that. I will do that with you. After we do the Zoom, I'm going to sign off the Zoom, and I'm going to talk to you about that because I have a thought on that. I want to thank you, thank all who come out here today, and thank our audience at home. Thank you again so much. Take care. Bye.